Good afternoon, everyone. I show it to be 2:45 Eastern. We will be getting back to the last session of the day. My name is Wesley Fowler. I'm an industrial hygienist by trade. Also manage our environmental and occupational health programs for Cut Energy Services and Patterson Tubular Services. And I'll be moderating this last session of presentations today. We will get started with Dr. Sarah Darrow of the University of Alberta. And we'll conclude today with a worker panel discussion on mental health needs and challenges from the oil and gas workers' perspectives, when we will be joined by mental health advocates Francisco Valenzuela, Jason Ross, and Jenna London. First up is Dr. Sarah Darrow, professor in the Department of Sociology, Faculty of Arts at the University of Alberta, who will be presenting mobile work and mental health workers in the Alberta oil sands. Sarah, I will stop sharing and I will let you share your screen. And the floor is yours.
There we go. Can you see that all right? So I'll get started. So thank you very much for the opportunity to be part of this this conference, and I'm looking forward to the panel afterwards as well with Fran and others. So I'm Sarah Darrow from University of Alberta, and I'm presenting today the results of a research project done here in the Alberta oil sands on mobile work and mental health. Notice I've added the word gender into the title because that will be a focus of the presentation today. So I first want to sort of review research on mental health among FIFO workers, fly in, fly out, and drive in, drive out workers, then present the findings from our research, and then at the end, let's spend a little bit of time at the end on what might be done to respond to the issues raised. I'm not sure how to, oh, there we go. Next slide. All right. So what we know about mental health among fly in, fly out workers in resource industries, including mining and oil and gas. There's a lot to be said here, but there has over the last couple of decades been a lot more interest and research in this area, especially coming out of Australia. While it's mostly focused on men, there has been a recent uptick as well in literature looking at women's experiences in these industries and workplaces. And this slide touches on some of the key issues in that literature, including heightened impacts on depression, anxiety, self-harm, and suicide, which we've been hearing about earlier in the presentations. But really importantly, existing theories about workplace mental health can't really fully or adequately account for the complexities of FIFO work and the impacts on mental health. And geographical mobility and movement and industrial precarity are contributing factors to mental health for fly in, fly out workers in particular. I'm not going to spend much time on this, but I do want to note that I think what has not happened enough is enough sort of linking of this research on fly in, fly out and mental health impacts with the literature on and research that's been done on male-dominated industries and workplaces. And that literature demonstrates implications for both men and women, sometimes the same and sometimes different, in terms of being in male-dominated industries. And so I'm hoping to sort of help contribute to that today. So a little bit about the context that I'm working in here in Alberta, in the Alberta oil sands. Been doing my work in Fort McMurray and the Athabasca Formation, which is touted as the world's third largest deposits, but sometimes this is contested. But there have been, large numbers of fly in, fly out workers who come from anywhere as close as a few hours drive away to, several hours air flight away for rotational work in the oil sands. Increasingly, they have been driving in, driving out. out, especially with in the last number of years, because they're coming from closer and or because the cost of flight is being put onto the workers. So the question we were working with is the question here on this slide about how do conditions of FIFO, which includes drive in, drive out for us, work, how does that work affect the mental health and well-being of oil sands workers? We did a two-phase study, a mixed method study with both a survey and also in-depth interviews. A bit of a profile overview of the participants in our project. And I won't go through all of these, but just to highlight the information in blue, highlighted in blue, is especially around sort of the gender differences we found. All of our participants did either identify as male or female, so we are working with just those two categories. And also in brown, we have those sort of precarious work sorts of findings or profile issues, which is people who were contracting and who were experiencing a lot of job change. And as you can see, we were really quite pleased that we got such a high percentage of women participating in the project. That's about twice the percentage. 30% is about twice the percentage actually found in the workforce. But as you can see, women were much more likely to have experienced discrimination and bullying at work or harassment, and they were also much more likely to be making under $100,000 a year. The health profile was concerning, and a number of these indicators around long-term health and health challenges were higher than in the general population. I also wanted to point out that this last stat around on the right-hand side there around working while sick, we found this to be a really key part of the culture, that as long as you've flown and are away from family for a week or more at a time, that you are going to go ahead and work. Even this quote from the supervisor at the bottom of the slide, who said, as long as you can pick your head up, you should be working. We looked at stressors in particular, and that's what I'll be focusing on today. And so as you can see among these stressors that we looked at, the ones that are bolded have to do with fly in, fly out. So traveling and commuting as stressful, living in camp, and then the most stressful of all at the bottom, distance from home and family. And so those were the things we were especially focusing on, those kinds of stressors associated with fly in, fly out. Okay. And while there were no significant reported differences between men and women on these items, our subjective findings from our interviews and from open-ended questions on the survey showed that these are in fact gendered. And that's one of the foci for what I'll be presenting to you today. Spoiler alert, this is the model we're working on for how to think about fly in, fly out stress, inseparable, of course, from on-the-job stressors, which is on the right side of your screen there. But we also then have to take into account the way that stress is related to being in camp, distance from home, and some of the organizational factors of the industry, and how stress circulates across these and compounds, as I will be showing today. So, for example, on the job stressors, are in fact intensified because you are living with some of the same people in camp that you're working with, day in, day out. So there's a compounding factor here across these multiple sites of the experience of fly in, fly out workers. So over the next several slides, I want to build a picture of this set of relationships, drawing on the narratives of our participants, both men and women. We will foreground the voices of women because they are often not heard in this literature. So I begin with stress on the job, and a number of our female participants put it in these terms as entering the land of men. And so as Christy so plainly puts it right in this quote, this is a basic underlying feature of discrimination, bullying, and exclusion as experienced on the job. And a number of women agreed that they had to work harder and respond to extra demands to constantly prove themselves to men. And more than 2/3 of the women in our study reported that most days at work were somewhat or very stressful compared to just 44% of men. At the same time, participants pointed out that the male male-dominated environment was unhealthy for both men and women. And as this male manager puts it, right, it requires an intensified and sometimes exhausting performance of masculinity and suppresses attention to psychological unsafety. So importantly, the isolation and strain that results is not limited to the job site. It carries over into camp, as I suggested earlier, right? When you're eating and sleeping next to, right, in the next room with very thin walls, the same people that you worked with. So interrelations across the locations and facets of the FIFO system add to everyone's isolation, but it takes on particular character for women. As Natalie says, the added burden of constantly managing across both the job site and camp adds to women's isolation. Many told us they have to set up really good boundaries or learn to joke and swear with the guys to cope with this culture. And as Marge points out, this sense that women are not supposed to be on the job carries over into camp living. This is not, so it adds to the isolation in that way as well. And importantly, the macho culture has particular effects for men in camp. We found a kind of narrative of emasculation, as found in this male trades workers narrative. You work so hard for this money and to be a provider, and you feel diminished by camp. You feel like you're just a number in a system, and you're living in these, sort of very minimal sorts of living conditions. And we also found men feeling isolated in camp because, like many women, they were trying to avoid sort of testy interactions and macho bravado. So they would just go straight to their rooms each evening. But of course, these dynamics go even further, affecting the loneliness of distance and time away from family and friends, which is something that's very well known to people who fly and fly out and live in camp for a week or two or sometimes months. So distance from home includes, importantly, the experience of transitioning back and forth, right, from the separate and often intensified selves of work and home. Both men and women talked about this kind of separation, but they did so in different ways. As Olivia's story shows, transitioning between paid job and mothering work has its own particular issues. Many FIFO parents speak about this difficulty of catching up and getting back in sync with home life when you return from being so intensively at work for a long period of time. And so they often put work and home life into these kind of compartments. And that's a coping mechanism for dealing with distance. So this leads to a kind of gendered tax for women, given the expectations of motherhood. As Olivia suggests, she's doing just as much work when at home as when at site. And on top of that, coping by compartmentalizing means she gets some judgment on her, feels this judgment about, is she, being seen as a disinterested mother, right? Because she's taking time away to be at a distance. So men discuss this transition in different terms, sometimes referring begrudgingly to being expected to step in and take on some of the care work at home when they wanted to, and all they wanted to do was catch up, right, on sleep. And by the same token, male participants were worried they brought home some of the toxic masculinity with them, as this quote on the right indicates. It's hard to go home and not be an asshole. Finally, it is important to circle back around to consider how the masculinized organizational characteristics of work in the oil sands industry adds to the stressor system. Mariah here indicates the uncertainty and time pressures of boom and bust, contractual work, and rotational and shift work, in this case, 60 straight night shifts, exacerbated by a kind of tough it out culture. And these stressors are felt by all, and often more acutely by people in precarious contract work. But they also have sort of gendered implications. This is in part due to the fact that women's income was significantly lower, but also arose for women as mothers. Christy, for example, knew several women whose employers had tried to fire them when they got pregnant, and being seen as lesser than means that women worry that during a downturn, they'll be the first to be let go. Gendered FIFO stressors intertwine with financial and familial stressors to bring real loss for both tradesmen and tradeswomen. Mandy, for example, finally walked away from FIFO oil sands work. This may have saved her life, but as a result, she lost employment and her house. I will say that supervisors also talked about the stresses of being monkeys in the middle. And most of them were men. In fact, in our study, almost all the supervisors were male. And they reported this kind of constant pressure being between the, downward pressure from management and at the same time trying to take care of their stressed crews. And so echoing findings in the growing literature on depression and suicide in male-dominated industries, 1 in 7 men in our study indicated occasional thoughts of self-harm when on rotation, with no women doing so. Some participants knew more than one man who had taken their life in camp, on site, or at home. Nelson called it an epidemic in his union hall. Christie said she had heard about suicide more and more in the oil sands. We don't have good stats on this, unfortunately. The deaths point to the urgent need for attention to stress, anxiety, and depression in FIFO-based resource work, including for those who lose one or more colleagues to suicide. So this really opens the question of what's to be done. But it's important that in our study, some of our findings point to the fact that some of the same causes of stress are also the barriers to doing something about it, right? And this points to the sort of the masculinist culture of, in particular, you don't talk about these issues, right? We're not supposed to talk about mental health. We're not supposed to talk about it might make us look weak, for example. This exacerbated another finding, which is that one of our clear findings was a deep mistrust around using health resources offered by employers. The majority of our participants indicated they would not use health resources at the site. And this was in part because they were afraid that it would come back to bite them. They wouldn't get called back for the next contract job. They would be sort of not seen as an ideal worker if in fact they had shown some kind of weakness by using health resources, either for physical or mental health concerns. As Olivia points out in this quote, even talking about mental health is suppressed. And so in short, some of the same factors, as I said, that contribute to creating stress and ill mental health also contribute to making it difficult to address. In terms of what to do, I don't have a lot of time to spend on this. Some of the worker recommendations out of our study are on the left side of the screen. Some of the things they themselves asked for in the survey. And then on the right are some of the additional recommendations that we also came up with. And I worked with a whole team, including Valerie O'Leary from Critical Incident Stress Management, who has lots of direct experience with workers in the oil sands. And so one of the things that she always wants to stress is the need for on-site services. And that goes hand in hand with the need for services that follow the worker, right, between the work site and home, and that are not limited to one or the other of those places. A second emphasis is on peer support through worker-led initiatives to address mental health, but also buddy programs, as has come up in earlier presentations. One of the things I've really been interested in is the Mates in Construction program in Australia, which has also been picked up now by the Newfoundland Construction Safety Association here in Canada. And so with that, I will say thank you and look forward to any questions.